Lovely. I love it when it works.
I think we're on.
But as long as the button works this week.
Well, I had to do something special to the button.
Okay. Well, hey.
Let's see. It's not
Whatever
there.
works.
Where are we?
Refresh the page.
I did.
Hi, everybody. Welcome to Wednesday, 5:30 p.m. Cooking with Cat and Steph. We are so excited to see you. Scroll back up. Click on the live video and see what that does. We're figuring things out as oh no, yeah, don't do that. This is saying you can do the video through the event.
Oh.
Cool. So go back. Cool. Well, that's okay. We are here. We are live. We are talking about all things dysphagia today. Steph's going to figure out the technology piece here as we're still learning how some of the Facebook stuff works with our, because we're not tech people. We are speech therapists and dietitians. So bear with us for just a second as we figure things out. So
you know what?
Are talking about, okay, that's perfect.
Yeah.
Is the
Hold on. It's on my private page. I don't understand why.
No, it's live in the group. It's just taking a second. So that's okay.
Okay.
So because on the if anyone's watching, they go to the notifications, it'll pop up that we're live there.
But it's my name. It's not Dysphagia Duo.
Yep.
So
that's okay. So
yep.
Facebook is also changing how they do a couple of things.
Yeah.
So as we figure out how Facebook is changing,
we found it and we figured it out. We're here. The button worked.
Yep. So perfect. I'm just gonna wait a couple of minutes while people figure out where we're at, and I'm actually going to share the link.
Good.
If I can.
Yes. I think that's a great idea. I'm going to, you got it?
Okay.
All right.
Yep.
We have someone.
It's showing up now. So
okay.
We're good. Thank you for joining us.
Yes.
Thank you for anyone's patience as they're watching the replay as we are figuring out how technology works, because like I said, we're not technologically inclined. Someday we'll have a person for that, but right now it's us.
It's just us. Sorry.
So I'm not sorry. We're doing the real work that we need to be doing.
Yes,
and
we
that
are.
is
and we love what we do.
Yes, bringing awareness about dysphagia to the world that doesn't know about it, and helping the people that are going through it.
And don't know where to find help.
Most importantly. Here we are for you. So if you're on and you're watching, please say hello. Please let us know where you're watching from. We're so excited to see you. And we are going to make a couple of fall-inspired dishes today. They're actually in the oven because it takes a while. So I'm going to check on them real quick. Looking good, looking good. Our little pie crust thingies are crispy, so we need to pull those out and put them someplace where they can.
Okay, I'll pull out the whole thing.
Okay.
Oh yeah, they may have gone a little too much, but they're pretty.
That's okay. They're cute. All right. So we are doing apple pie. And we have a couple of different ways to do it, so we can walk you through how to enjoy apple pie as someone who's having a swallowing difficulty. We are also making butternut squash soup. And I'll post the picture of the pre-soup here in a little bit. So we're roasting it. So we took a butternut squash, we cut it in half. We did cherry tomatoes, which I picked from my garden earlier today. They're very ripe, very sweet. A couple of carrots. I just cut off the ends, washed them, didn't even peel them. A red onion, a bulb of garlic, and I think that was
Carrots? Did you say carrots?
Carrots.
Oh.
Butternut squash, yeah. So that's in the oven. I did herbs, dried herbs, and olive oil over the top, and it's roasting. So we're gonna puree it here in a little bit. We're also going to add a little bit of tofu for some extra protein. This doesn't have any flavor, so
it will take on the flavor of anything that you cook with it.
And for anyone that wants a little more calories, you can add heavy cream or you can add coconut cream depending on what you tolerate GI wise. So it's really important to know what foods your body likes and doesn't like. So if you can't have dairy, coconut cream is a fantastic substitute. So butternut squash soup going, apple pies are going. Tell us a little bit about dysphagia.
Yeah, let's talk about dysphagia.
What is it?
It's one of my favorite topics
I know this.
to talk about.
I know this. It's one of the reasons that you and I became good friends is because we both have this interest in this topic, and it sort of centered around food.
It
in the
started
beginning.
with food for sure,
Yeah.
and it has revolved around food
The whole time.
since.
Yeah.
So dysphagia basically is just any difficulty with swallowing
Anything.
anything. It may be related to chewing. It may be related to strength and movement. It may be related to coordination of those muscles. Difficulty swallowing.
Muscle weakness.
Yes.
A lot of the time, I think we're seeing.
Much of the time.
Yeah.
Even if your problems with eating didn't start out as dysphagia, the lack of nutrients and the lack of use. So if you're eating less and less and less, those muscles aren't used as much. And what we're finding, Kat and I, with our clients, is that it didn't start out as dysphagia, but it became dysphagia from malnutrition and non-use.
And so we have people with multiple issues. They start with a nutritional issue that wasn't addressed because doctors don't typically address nutritional issues, which not their fault. They are not trained on nutrition unless you get a doctor that went to school and has like a bachelor's in nutrition before they went to med school, or it was something like reflux and they tried to address it medically, which is the way we go a lot of the time, and it wasn't addressed nutritionally, and then it got worse, or maybe wasn't addressed full circle, and now it's gotten in. I got ahead of us with that, but so
it happens.
And so we see that people with swallowing difficulties end up with nutritional deficits, and people with nutritional deficits end up with swallowing difficulties. And then if you don't address whichever one, it cycles, and it just gets worse and worse from there. So we have to stop the cycle.
Right. It's just like what came first, the chicken or the egg.
Yeah. Right.
It could go either way.
Right. So how many people have dysphagia?
Well, I am told that 1 in 25 adults will deal with dysphagia by the end of this year. 1 of 25 worldwide. That's a lot of people.
That's a lot of people. And so one of the statistics that I have seen recently is that 1 in 6 will deal with dysphagia in the course of their lifetime.
Well, and I think that this statistic is people who are diagnosed with dysphagia. Now, there are a lot of people out there. As a matter of fact, the majority of the people Kat and I talk with do not have a diagnosis of dysphagia because one reason or another, I don't know if they're not believed that the problem is real, or if
their tests show that they're normal.
Right. So a test can show that it's normal.
We're going to get into that a little more as we talk through this too, but that's one of the things that we see.
That is very common, that if you don't aspirate on a video swallow study or a modified barium swallow, you're normal.
Right.
Unless you have just scathing deficits in your swallow.
Right.
Like obvious deficits in your swallow.
Right.
You're going to be considered normal.
Yeah. Okay.
That hurts my heart.
I know, mine too, because we see it all the time, and it breaks my heart. I reach out to people almost daily at this point on Facebook, Instagram, TikTok, and YouTube about, they said there's nothing wrong with me. They said they said to go to this next specialist because this specialist couldn't figure it out. I've lost X amount of weight. I can't eat or drink. I'm depressed. I'm foggy. I can't think straight. Etc. 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 Janet says, is there a lot of diversity in the diagnosis? Fabulous question, Janet. Thank you.
Diversity in the diagnosis, yes. Like,
we could see 10 people and they all have different
reasons for what's going on.
Yes.
Or different specifics
Yeah.
surrounding
Yeah.
the different details of their swallowing
It could
deficit.
be head and neck cancer and treatment, or the surgery, or the radiation, or etc. So even the head and neck cancer could have a different cause for the dysphagia in there. We could have someone with a stroke. We could have someone with Parkinson's. We could have someone with anxiety. We could have someone with muscular dystrophy. We could have...
Or someone who went in for knee surgery and was intubated and couldn't swallow after they came out of surgery.
I see that on occasion in the...
It happens
The
a
hospital
lot
I work
more
at.
often than you think.
And typically those people are the ones that receive... I don't want to scare anybody. Never mind. I'm not going to continue with that. If you're curious, let me know. It's not a big deal. It doesn't happen all the time, but it does happen.
But if you have surgery and you can't swallow afterward, there may be a reason why.
And I did have a patient that woke up and was having difficulty swallowing. Come to find out, the speech therapist that was on contract had left because she never got called.
Oh.
So she didn't even live in the area anymore, and they didn't even know they didn't have a contract with her because they don't need at this place
Very often.
very often.
Well, maybe they should call me.
I called you that day.
Gotcha.
What do I do? They're asking me for help, and I'm not a speech therapist.
Gotcha.
Yeah.
I remember that day.
Yep. So it happens on occasion. And the other thing that I was thinking is that it could happen because of a choking incident. So it could be a fear, and that fear can cause symptoms as well. So
There may be reflux. There may be GERD. There may be EOE, eosinophilic esophagitis.
Yes.
There could be a Barrett's esophagus. There
Yes.
could be, there's so many
Yes.
different things, and each one has their specific details.
yes. So Janet, I talked to a dietitian who said that dysphagia is not a diagnosis but a symptom. I would say that's accurate some of the time.
I don't agree because ICD-10 has a number for it, which means
diagnosis.
it's a diagnosis.
It is a diagnosis. So sometimes it happens because of something else, right? So it's a symptom of something else, but it's a problem in and of itself, which means it is a diagnosis, and they treat it. That's why speech therapists work in hospitals, nursing homes. Where else do you treat?
Rehab agencies,
Yes.
outpatient, home health care.
Yes. So I feel like that's two-sided.
It can be a symptom of something going on, but then it's a
Also.
diagnosis
Yes.
in addition to whatever that
Yes.
it's a symptom to.
So for those of you that are on right now, I think there are 3 of you on, I would like for you to put in the comments what this causes for you. What kind of psychological things you feel because of. So is it painful? Is it frustrating? Etc. So let me know some words that you would use to describe what you're going through.
I'm going to add one to that because until this last couple weeks with our new clients, I've not, I mean, this week, was it this week or last week, that we've heard a couple of people say, I'm so hungry
Yeah.
and I can't eat.
Yeah.
Typically,
Yeah.
we find that people just don't get hungry anymore, so they start losing weight. But now there are people reaching out to us that are saying,
Confusing. It's a great one.
that
Yes.
is a great one.
Yes.
But people being hungry.
Yeah. Yeah. And it breaks my heart. And the providers are disregarding that complaint that they're hungry, which is hugely psychologically problematic. Right. Because your body needs a hunger signal, because that's a sign that you need to feed yourself. And if your doctor is now telling you that your hunger is not important, that is psychologically a problem.
Well, and it's training your brain that you don't need to do anything about that.
And you do.
And so then you start losing that sensation of being hungry.
Yeah.
Don't like it. Don't like it at all.
I'm going to add a couple of things to the blender because they are cooked all the way. What do you have next?
Well, we're going to talk about the different types of dysphagia. So there are actually 3 traditional types of dysphagia, but I'm going to add 2 more because we're seeing a lot more of it. And it is actually something that's being researched a lot. So first type of dysphagia is oral dysphagia, and that dysphagia, and that is when it affects the muscles of the oral phase of swallowing. So the mouth, essentially.
Onions.
Everything from the lips, the cheeks, the teeth can affect the ability to manage the oral phase. So if you don't have teeth, time consuming leads to more complex medical issues. That was actually medically complex was one that we had on our list.
Yes.
Mary.
So I have carrots.
Kathy, in liquids, no thickener helps. All types of levels used by Home Health ST can't hydrate well. Okay, we need to talk about that. Hydration is foundational to treating dysautonomia. Yes. So don't have my port anymore. Don't want a GJ. Had a G-tube and got sepsis. Holy, you've been through it, Kathy. You have been through it. I get it. Yes. Hydration is one of the biggest things that we like to work on with people. And that's one of the things that we monitor a lot with people is what their hydration is. A lot of swallowing, particularly pharyngeal phase, oral and pharyngeal phase swallowing deficits can be directly related to dehydration because the mucous membranes of the swallowing tract need to be moist.
And that's why we did a whole talk on hydration last week. Yeah. So if you want to know more about the hydration and things you can add in, watch last week's episode. Yeah.
Was that just last week?
It was just last week. This last week has been really fast and really slow at the same time. Yeah. Kathy, it sounds like, because I know we spoke with you a while, it sounds like we need to have another conversation.
Yeah.
So much has happened since then.
We need to talk again.
Yeah, absolutely.
All right. So oral phase, mouth. Tongue, cheeks, lips, not in that order, obviously. The pharyngeal phase of swallow.
So here, back here.
Yes. Well, yes. The pharyngeal phase actually starts at the base of the tongue.
So back here? Or
yes.
Ish.
Kind of right at or about behind where the tonsils, if you have tonsils, right at about. That's where the pharyngeal phase starts.
Where when you're gargling, you don't want it to go past.
That's where it starts.
Okay, perfect.
Yes. Good.
Just trying to understand in the best way that I can. Yes.
So, and if you can't gargle, there's a problem. Because you
yes.
need those muscles to be able to contract.
Yeah.
So the pharyngeal phase, there are so many small muscles that are required to be very precise and very coordinated to get what you're swallowing to where it needs to go. You know what we forgot to bring?
What did we forget? George, you want me to go get him?
I
can't squeeze this garlic in yet because it's too hot for my little fingers, but it smells delightful. So I can go grab George real quick while you're talking. Okay.
So pharyngeal phase again. So it's very important for all of those muscles to be coordinated. One muscle out of coordination will throw everything off, and that's where people start getting that sensation that something's stuck there. Well, maybe it is because maybe that's the area that's not moving like it should. And so it may have just less movement, so it can't move everything out of it. Boys, Cat was running,
and the dog got very excited. So this is George. We use him all the time. So I'll let you.
Yeah. So pharyngeal phase,
professional. The professional can.
So let's talk with George here. I know it smells good, doesn't it, buddy? Okay, so George, this is his tongue. It's a little delayed, so I can't look at it.
You do the best you can.
I will do the best I can. So base of tongue would be about here, where the pharyngeal phase starts. The pharyngeal phase ends when it gets to the esophagus.
The upper esophageal sphincter.
So the upper esophageal sphincter is here. So it starts here and it ends here. There's a ton of little muscles that have to work in this area to get everything to go down the back tube. Mm-hmm. Now, if you look here, this side is the breathing tube. Notice how much bigger the breathing tube is than the esophagus. So the risk of it going down in this bigger breathing tube is great if all of these muscles aren't working in coordination.
Right. So
very important that this pharyngeal phase, and that's a big phase that we see a lot of deficits in.
Yeah.
Frequently, we'll treat the oral and the pharyngeal phase together, but not everyone needs that.
Right.
But there are ways to work those muscles, and we had someone asked today that said that a therapist told her that just eating is exercise, and that is true. It is. It's going to help get those muscles, the thicker and the more solid the thing that you swallow, the more strength those muscles need.
Yeah.
Okay, so thin liquids don't need much strength. They need lots of speed and coordination, but the solids is where you're going to get the exercise.
Yep.
However, if there is a deficit in one of those, how do you pick and choose? I mean, how do you, if we know...
need a speech therapist.
Well, that's what I'm trying to get at. I'm trying to get at, and I keep stuttering on my own words. But I can't tell you what exercises to do unless I know more about your swallow.
Right. Right, because
more about the specifics of your swallow.
Everyone's deficit is a little bit different.
Yes.
And so...
and I don't want to give recommendations that could harm you.
Correct.
Because one thing that I tell one person may be detrimental to another.
Right. And this is it. So everything that you would be told is specific to your situation.
Right.
So you have to be cautious about taking advice from other people that are not a trained speech therapist. I got garlic on your shirt. I'm sorry.
It's what washing machines
It'll smell delicious.
It would get washed anyway.
Yep.
All right.
So pharyngeal. Yeah.
So that's the pharyngeal phase. Mm-hmm. Are there any questions about the pharyngeal phase?
I'm sure there are a lot.
If not, I'm going to move on to the esophageal phase.
Yes.
You know a lot about the esophageal phase.
I've done a little bit of research.
Yeah. We have had several clients with
esophageal deficiencies. Yeah.
Yes. Mm-hmm. So there are so many things that could go on in the esophagus. There is nothing in the esophagus that I can exercise to make it better.
It's more of a nutritional type, or there are some food texture changes that we can work with.
But one of the things that I want everyone to consider is if you have an esophageal dysphagia or difficulty or problem, that can very quickly and easily lead to difficulties at the pharyngeal level. Reflux can cause esophageal issues first, but untreated, it can move as high as your nasal cavity.
Yes.
And create more problems.
Right.
Or you have so many problems with your esophagus that you are so limited at what you can eat or what you're willing to eat because it hurts, that you become malnourished.
Yep.
And those muscles become weak.
Right.
So non-use dysphagia is a real thing.
Yes. Yes. So we are going to dive more into oral dysphagia next week, pharyngeal dysphagia the week after, and then esophageal dysphagia the week after that.
Yes.
So we're going to dive into these in detail moving forward. So if there's anyone that you are specifically interested in, or if you're just interested in more detail about each one, join us, bring your questions. We're of course going to be cooking something. It will likely be fall related because 'tis October.
And we love fall food.
And we love warm fall food, even though it was 80 degrees here today.
But tomorrow's changing.
Tomorrow it's going to rain. So soup is perfect.
Yes.
So we had sort of discussed causes of dysphagia. Are we ready to jump into that, or
no,
you have
because
more?
I have 2 more types of dysphagia
Oh.
that I failed to write on that.
Tell me more.
So there's something called functional dysphagia, and there's a lot of research on it.
Yes, there is.
And functional dysphagia basically means you have difficulty swallowing, and we don't know why.
And we can't figure out why. All the tests are normal.
Right. So there are a lot of maybe providers that are unwilling to use that diagnosis and would rather just send you home and say there's nothing wrong.
And a lot of that is not their fault.
It isn't.
It's because they've never heard of it before.
And they don't know who to reach out to. We're happy to help them understand.
Yes.
We want to. So but that's what we're here for.
Can I tell you a little quick story about this topic?
Yeah.
I have a brand new speech therapist working in one of my facilities. She's awesome. She's so good. She'd never heard of functional dysphagia before. And I asked her a couple weeks ago, I said, have you ever heard about functional dysphagia? She goes, you're the first person to tell me that. She goes, but the more I've thought about it, I've seen it a lot. And I was like, yes, you probably have. So now you have a name for it.
Yep.
Now you can move forward with it.
Yep.
So it was really exciting to me that I got to teach this new baby speech therapist who's going to be amazing once she gets through,
That's
like
awesome.
I'm super excited for her.
Yeah.
So
Yeah. I am too.
I might convince her to join this team when we're ready.
When maybe we'll hire her.
I like her that much.
I like it.
Yeah.
All right. So functional dysphagia. They don't know why, but there's something going on, or they're saying that there's nothing wrong. So if you know that there's something wrong, but you're getting just go home and eat.
Right. It's all in your head.
We know that there's a diagnosis out there for you, and it's called functional dysphagia. The last one is called muscle tension dysphagia, and that we find is much related to anxiety.
Yes. And so I think muscle tension falls in the functional dysphagia realm, but it's specific
to
the coordination and what's happening with the muscles.
Yes.
Okay.
I have to go deal with this.
Deal with the dog real quick. So in here, we're going to take a segue real quick and talk about nutrition while she's letting the dog out. So we love color, right? So in our soup today, we've got butternut squash, which is oranges and yellows, and carrots, which are also orange. So the nutrients in here are carotenoids, lutein, zeaxanthin, and hesperidin. Great for your brain, great for your immune system, anti-inflammatory, great for your eyes, protects your skin from UV radiation, and it helps restore your energy and increases vitality. So there's a little bit on the oranges and yellows, which are the butternut squash, the carrots. We don't have a yellow onion in here. And then we have the whites and browns, which are the garlic, great for blood pressure and cholesterol, reduces your risk of stomach cancer, great for osteoporosis and heart disease treatment. They help get rid of free radicals, which are the things that cause damage inside your body. And they're great for your hormones. So we'll start with the whites and browns. We like lots of colors in our foods because each one has a different property that is helpful to your body. So I'm gonna check on my butternut squash. I was hoping it would be done already, so I apologize. It just took a little while. Yep. All right, so butternut squash. And my hair fell out of my, don't burn yourself. I will just move some things around here because this is toasty. Okay, so you were saying muscle tension dysphagia. Tell me more. So you were saying anxiety and muscle tension dysphagia.
So anxiety can do crazy things. Everybody knows that anxiety can do crazy things, and who would have thought that it could affect your swallowing? Now, anxiety can come from a number of reasons.
Yep.
Some people's anxiety comes from having choked before or having seen someone choke, and so they're fearful of it.
Yeah.
But it can come from other anxieties too, that the tension that's in your body from that anxiety just throws the coordination of those muscles off.
Yep. It's really scary.
Are there things that we can do about that? Absolutely.
Yes, there are. You know what I didn't get out was broth. So I might just use a little bit of either water or oat milk. Unless you have a can or a carton. Whew. Yeah, this is toasty. So I decided to use the blender for this because I like the fact that it has a hole in the lid so we can release the steam as we're blending it. So, sorry I wasn't prepared. I forgot about my broth needs.
Alright, we don't have the milk out either.
No, that's okay. Well, this is so hot. Oh my goodness.
How much do you need?
Let's do like 3 cups. Okay, does anyone have any questions about the muscle tension or functional dysphagia? Because we're just seeing so much of it. And we're seeing a lot of doctors that just don't know where to go from there because they don't know what they're dealing with. They don't know who to refer to because it's not necessarily a GI issue and it's not an ear, nose, and throat doctor issue. And so that is really frustrating for the doctors because they don't know what's going on. And if you have a provider who's busy and can't take the time to do a little bit of research, you're not going to get an answer. So like I said at the beginning, we want to provide you with resources and we want to raise awareness for our healthcare providers about these topics because if we don't tell them, who's going to? So that's part of our mission right now is to just get people aware of these problems. So I don't see any questions, so I'm going to move on to the causes of dysphagia.
Yeah, go ahead. Yeah,
so we already sort of started on this. So I said Parkinson's disease. I said stroke. I said cancer. And it doesn't have to be just head and neck cancer like I had mentioned before. It could be stomach cancer. It could be esophageal cancer. It could be thyroid cancer. It's anywhere in the head and neck area. It could be brain. It could be, it could be
any cancer.
It could be any cancer.
Yeah.
Yes. So, we mentioned eosinophilic esophagitis. So, for anyone that doesn't know what that means, eosinophils are a type of white blood cell, And sometimes the body makes a lot of them and sends them places to destroy things that it doesn't like. So Mary says, can a psychiatrist help with functional dysphagia? My ENT had suggested a referral to one. So before I let Stephanie answer this, I'm going to give you my answer. And my answer is, I think a psychiatrist can be helpful in the anxiety department. However, if you now have a discoordination of these muscles, a psychiatrist cannot get you to retrain these muscles. So you need a psychiatrist and a speech therapist. Thoughts?
Yes. I wouldn't be able to treat any of your anxiety.
Right.
I treat,
we can
specific,
talk.
we can
talk about that a little bit. Yes.
Well, so,
I say we.
I am not trained as a psychiatrist
Right.
or a psychologist or
Right.
a counselor
Right.
or anything. We do address a lot of anxiety, but not in depth. So I wouldn't expect a psychologist or a psychiatrist to know the details of what I do in swallowing therapy.
Right.
And so our first client came to us because her counselor said, I can't bring you beyond this because I don't know what's going on with your swallowing.
Her counselor was trying to get her to do food exposure, so starting new solid foods all the time, and this woman could only literally eat baby food. And so her counselor was trying to expose her to food textures that she didn't know how to physically swallow.
She couldn't.
And so she finally came to us, and we were like, well, that's a terrible idea because your counselor doesn't understand what's going on here. And I don't either. That's why Stephanie and I work together. So.
And what's the last thing she ate when she was on
pizza?
With us?
She ate pizza with us. It was so. We highly recommend. So, read rehabilitation or sports medicine doctor. Say that again, Mary. Can you type that out again? I'm not sure I understand.
A rehab doc?
Sports
medicine doctor is...
I
would say no.
So, if they understand how the oral
a physiatrist. I see. Okay, you said, can a physiatrist help with functional dysphagia?
I can't read. I'm sorry.
Probably.
I can. I just wasn't
so a
paying
rehab
attention.
doc. Yeah. So
sorry, Mary.
So a physiatrist, a physiatrist would probably say, "Hey, I need you to see my speech therapist."
Yeah.
They usually don't.
They specialize in
specific information.
Sorry, I think I probably read that totally wrong because I just assumed I read it right. So I'm sorry, Mary. Thank you for clarifying. It's
okay. So I've worked with many physiatrists over the years, and they usually came to me and asked, can you work with this, or can you do this, or what's going on with this. So I would say they probably would steer you towards a speech pathologist.
Right. Yeah. Okay. So eosinophilic esophagitis, we address that with medication and nutritionally. You need to know nutritionally what is causing the sensitivity and why the eosinophils are traveling to your esophagus, because they're trying to fight something. So it's an autoimmune disorder. An esophageal stricture is a narrowing. So it gets really thin. Talked to someone yesterday who said they'd had 2 or 3 dilations, so they widen it. And I know a lot of the people we talk to, and probably a lot of you that are on right now, have had this procedure done. It's very common. So we talked about reflux. You talked about intubation, advanced age. Do you want to just pour that right in here?
All of it?
As much as you can up to the, xerostomia, which is dry mouth. Oh yeah, that looks good.
Which may
beautiful
scream dehydration.
Dehydration, yes. Let's see, and there are more. So we also have the ones that are related to chewing. So TMJ, I have TMJ. I don't like to eat tough, chewy things because it hurts, and then I have to spit it out because I can't swallow it. I'm not gonna, if I can't chew it, we want you to chew well. Broken teeth, missing teeth, no teeth, dentures that don't fit.
That's a big one,
It's
actually.
Huge, and I see it all the time in people who have lost weight.
Mm-hmm.
And if they've lost weight, then their dentures don't fit, and then they can't swallow because their dentures don't fit, and they probably lost muscle mass as well. So it's the weight loss thing is a huge problem. Mouth pain, just in general. Could be an infection, could be...
You just don't know. Some medications cause mouth pain, and you end up with sores. I actually have someone at my facility right now who was actually given a G-tube because of the sores in her mouth. She couldn't eat.
Oh, that breaks my heart.
And so now we're dealing with sensory stuff because she's averse to anything.
Oh, that's so hard. That's one of the things my mom, who's an OT, wants to talk about as well. So super fascinated. Can't wait for that conversation. So symptoms.
All right.
What are overall symptoms? Next week when we talk about oral, we're going to talk about specific oral symptoms only. But today we're just going to go through everything, and I'm going to start blending this. It's going to be loud for just a second. I'm sorry.
Maybe a minute.
Yeah.
Maybe a minute. So drooling, gagging, choking, coughing.
Oh, it doesn't like blend. Hold on.
You have to use this side with that.
Puree.
I am going to wait just a minute because that's going to get loud.
Put us on mute. So drooling. Yeah. So if you, Janet says my voice gets froggy. So what are symptoms that you all are having? Sorry about the noise. When we do that, feel free to put us on mute. Stephanie's gonna take it in the other room and turn it on so we can get it as smooth as possible. So with a soup like this as well, because we're just gonna blend it until it's completely smooth. If you need it even smoother, strain it. Put it through a strainer, take a spatula and just kind of work it through that strainer until as much of the liquid comes out, and you'll have a little bit of pulp left. I'm gonna get our pie, and we're gonna start working on that a little bit here too. So, can you hear that blender still going? If you can, please say blender. I just want to make sure that it's not too loud for you to hear me still. So, drooling, gagging, and choking. Janet, when Stephanie comes back in here, I want her to address that your voice gets froggy and talk about that a little bit more, because that's a big one. Heartburn or pain, feeling like something gets stuck can be a problem. Runny nose was a big one for me that I wasn't aware of. Megan says we can still hear the blend a little. I'm sorry, Megan. Okay. Thank you. The room she put in is not quite far enough away, and that blender's really loud. I apologize. Sometimes we struggle with this because we want to get our food as liquefied or pureed as you need it, and it can be a little bit difficult sometimes with how loud it has to be, so I apologize. And Facebook doesn't have an option to deaden the background. Yeah, Kathy, runny nose. This one was interesting to me because I didn't understand why, and Stephanie explained to me that anytime something gets in a place it's not supposed to be, the body produces that liquid to flush it out. And so this could be watery eyes. It could be the runny nose. It could be excess saliva production because your body is just trying to wash things out of places that they're not supposed to be in. Weight loss. Could be weight gain because your body is in starvation mode and it's literally holding on to every calorie. So you're exhausted, you can't lose weight, and you're not getting anything in. So it's very confusing. Trouble swallowing pills or medications. And if my husband hops on and watches this, I'm going to tell about his sort of experience when he was in the hospital in May. When he woke up from surgery, they were trying to get him to swallow pills. And he had a bunch of things happen to him that were just crazy. And he woke up from surgery and he was chewing his pills. And we realized later that he wasn't quite awake yet, right? He had a bunch of medications and anesthesia in his system, but he'd also had a number of strokes prior to this happening, and we didn't know what his swallowing deficit was. So they took the breathing tube out of him. He came off the ventilator when he woke up from surgery, and he was chewing his pills. And we laughed at him. Only recently did I realize that he was doing that because he couldn't swallow pills. So it could be the medications. So I think I covered most of these symptoms, but Janet said my voice gets a little froggy. So I wanted you to address that one in particular.
Okay. So by froggy, does that mean like kind of gurgly?
Like wet sounding?
Yeah. So when you say frog, my first instinct is that maybe there is some kind of food or liquid. So you don't want your voice to be affected at all, because that's the wrong tube. Mm-hmm. So if we look at George, the food needs to go down this back tube, and your vocal cords are over here in the front tube. So if you have a froggy voice, you might have a little food hanging out in this area, which would scream weakness to me in some of these muscles, that the vibration of the vocal cords is kind of vibrating that food or liquid that's hanging out.
Thank you. So I covered the rest of these. Oh, the only one I didn't cover was regurgitation. So, and then I haven't addressed the ones on the screen yet. So okay. The regurgitation could be a weakness in the esophagus. So if the esophagus is not pushing food down, because it pushes in waves, right? And so if the muscles in the esophagus are not pushing the food down in waves like it's supposed to, it's possible that some of that food is hanging out and coming back up. So it doesn't go down all the way. It goes down part of the way. It doesn't get to the stomach acid, so it's not reflux. There's a difference. You are going to strain it. Beautiful. So we are going to thicken a little bit as well with some potato flakes. We're not going to use traditional thickener. So I gotta scroll up on my notes just a little. Where's the mouse at?
Right here.
Oh, it's over there. These Apple products are so fancy. I can't even.
Well, you have to push down.
It's over on that one. So I believe it was Mary who said congested and difficulty breathing. Yes, this is also a symptom that something is not happening in the right place, or things are going into the wrong place. So the congestion to me also means possible food sensitivity.
It could. Could
it be an allergy? Could it be that your body doesn't like something and your body has an immune reaction? It doesn't mean an allergy. A sensitivity may be that your body is just trying to send immune cells, like white blood cells, to a place, and it's causing congestion. And it's not necessarily traumatic, but it's very frustrating. It's very confusing because the allergy medicine doesn't work, and it's because there's something going on with food. It also could be that there's food or liquids going into places and your body's trying to wash it out also, which is where that runny nose and the watery eyes comes from as well. Janet says, it's like I need to clear my throat all the time.
I would say there's weakness in the pharyngeal level. That's my gut instinct.
Hi, Kara. Nice of you to join us. She says, I get a runny nose and sometimes a small cough or my nose will tingle. Yes.
So I feel like if we're going to use potato flakes, we need to heat this up some.
Okay, because it got a little bit chilly.
Well, as straining it.
It's still steaming. I can still, but do you want me to pop it in the microwave real quick? Just for like 30 seconds?
Sure.
Should I put a paper towel over the top?
No.
And you want to chop up some cookies? My little chopper, I put turmeric, fresh turmeric in here, so now it's dyed yellow.
The best color. Best color to, if you're going to accidentally dye something, yellow is the color I want to do.
The way to go.
All right, so I am planning to make,
So we have apple pie.
and that is going to be the soft and bite size.
Yep.
Or without the crunchy edges.
Yep. So we'll take the crunchy edges off of there. Let's see what else. Yeah. You want a bowl?
Yes. No. We're gonna do it in our mold.
Okay.
I'm gonna just mix it in a. All the shopping we did yesterday, day before yesterday, for our special surprise.
And my brain can't remember.
So
My brain cannot remember.
I took a pack of Lorna Doones.
Yep.
We're gonna make a pureed crust. We're gonna make it out of Lorna Doones. So I'm just really making powdered cookies, essentially.
Okay. So our soup I heated. And then we're going to add some potato flakes to our soup. I'm going to give it a taste first.
I may have tasted it upstairs a little bit.
Good. It does need a little salt, but we can.
Well, this might have a little.
This might have
saltiness
plenty
in
of
it.
salt. Ooh, buttery.
So we're using potatoes because then that's a natural.
It's a natural thickener. And as we learned last week, the potato flakes have to be heated in order to work properly. So this was fantastic. So, oh yeah. And so this right here is going to be a level 4 extremely thick, because when I tip it upside down and it falls off in one lump. It doesn't run. Okay? So we could even add a little bit more to this because this is very extremely thick. It's beautiful.
So you could put the potatoes in while on the stove, and
Yeah.
they would break down a little
Yeah.
easier. So are you gonna show the?
So we're going to take a little pumpkin cookie cutter, and we're going to
That's a squash.
squash. Sorry, this is the pumpkin. Obviously, you'd think I'd know my
You do
vegetables
know.
as the chef of the group.
Right.
Who knows what's going on in my
So
brain sometimes.
we're molding this to look like the food that it represents.
Yes.
So we're just putting it in. It's actually cookie cutters that don't have a top.
And I probably should have greased the mold a little bit, but it's okay. We're gonna see what happens. And if I had a little bit of like green, like parsley oil, or if I took some oil and I blended some parsley leaves in it and then strained it, I would have this beautiful bright green oil. And I could just drizzle that on top. Okay, we're gonna see how this. Well, isn't that just perfect? So if you
Squash soup.
I love it. This is this is the way to go. So I think we got these at Hobby Lobby for like $2.99 or something. And it came with 3 sizes of this and then 3 sizes of pumpkins. And totally worth it because now you can make your food look prettier.
Yes.
Don't you love it?
I'm
not going to eat this one because I want to take a picture of it. So tell us what your thoughts are. Is this too much work? All the time, yes, probably. But on occasion, when you just need it to look nice and cute and fun, this might be the way to go. So this soup is really wonderful for anyone. You can do this for anyone that's on a level 3, a pureed. I know I haven't even tasted it yet. Level 3 is liquidized. So our soup normally would be like a level 3 because it's a little bit thicker. It's not going to run through our funnel, doing the funnel test for the liquids well.
And it would be thinner. You could leave it thinner, but then you wouldn't be able to mold it. We only thickened it to this level so that we could put it in a mold and show you our fun excitement.
Because we want it to be fun, and so here's our soup. Suzanne, thank you for sending the recipe. I appreciate it. So we have our soup that if you just want to do it as soup, we like teacups because it's beautiful, it's fun, it makes you feel good. Okay, so you are gonna do the pizza pie.
Well, it's a pizza cookie cutter, but I'm calling it pie.
I love it. I love it. Okay, so I'm going to touch on some complications of dysphagia real quick while she's molding our pie. So it could be weight loss, which we've talked about a little bit. Anxiety could be a symptom or a complication. Newly developed anxiety, which we also see a lot. Depression. We see so many people that are depressed. And it just breaks my heart because we need to help all of you. We need to help all of you through this so that we can get over that depression that goes along with not being able to eat and drink normally, not being able to spend time socially with your loved ones, not being able to eat in public, being scared to do just about anything relating to food or even drinking liquids. And then the most, I was going to say the most serious. I would also say the depression is very, very, very serious. But the pneumonia, the risk of developing pneumonia. So if you're aspirating enough times and you get enough bacteria in your lungs that your lungs cannot fight it off, you will get pneumonia.
Right. Now, there's new research out that says you shouldn't worry about pneumonia as much as we used to. That it is rare for aspiration to actually lead to pneumonia, and it's really only in instances that are quite severe. So significant amounts of aspiration. So don't freak out too much about aspiration pneumonia.
Yep.
Reach out to us before that.
Yep.
But
there's no panic here.
No.
Do not panic.
No.
We will answer your questions. Reach out to us. Facebook, Instagram, email, TikTok, YouTube.
Yep.
However you can get a hold of us. You can also text us, call us, 574-475-7285.
Right.
If someone really wants the cell number and they don't want to rewatch this whole thing, just say cell number and I'll write it down.
Right. So I have made my crust with crumbled Lorna Doones because they absorb liquid much quicker and easier. We pulse those. I might pulse them a little bit smaller next time, maybe in a blender. And then I put melted butter and just a teeny bit of oat milk. I chose oat milk because that's what I have in the fridge. I don't have any real milk right now. Normally I do, but I would have used some of that. So I got it to a thicker pureed consistency. Now what this is called apple butter. It's a thinner apple butter. I made this weekend. We made some apple sauce, and we can talk about the chunks in that one.
Oh, I'm going to get another plate.
But this is apple butter, and it's super smooth, and it's pretty thick. I don't like my apple butter too thick because then it starts getting...
Because you don't like the texture of cooked fruit. And if it's too
But
thick,
I like this.
That's fine. I get that. I understand the textural difference here.
So I'm putting apple butter for my pureed apple pie. I did not save enough topping to put a top crust, but you could actually put a top crust.
You could do it again and sprinkle more of the crust that you make over the top.
So here we go, people. You ready?
This is so exciting.
It's
I'm
the
so
unveiling.
excited. Is it going to stay? Oh, it's beautiful.
Here is our pureed apple pie, and it looks like apple pie.
Read what Mary just said.
I wish I had known this about aspiration. A big relief to understand and not be so fearful about it.
Amen.
Don't freak out about it. There's new research saying that we shouldn't even thicken liquids anymore.
And I'm interested to see how long this will take to actually go into effect.
Yeah. So that's the new research. So we here at Dysphagia Duo stay current in research, and that is the new thing that's coming out. That don't freak out about it.
Right.
It would take a lot of aspiration
because
for you to get pneumonia.
Your lungs have their own flora, just like your skin does, just like your stomach and your intestines do. You have good bacteria in and on your body that protects you. That includes in your lungs. And as long as we can keep your nutrition status where it needs to be, your flora is going to continue to protect you even if you are aspirating.
I thought I had whipped cream,
Oh,
but I don't.
Sad.
Whipped cream would be a little
It would be
on
so
top.
perfect on
So
there.
this is pureed
Okay.
apple pie,
Okay.
everyone,
So
with apple butter.
put that one right here.
Okay.
Oh my gosh, that's so tasty.
Yeah.
Our soup mash concoction. Okay, you want to do the...
Yes. So let's unveil. Just made these right before we started.
Oh, so Suzanne sent me this recipe via Instagram. It was a video. So Suzanne, if you wouldn't mind, can you go back and post the link to the video in the comments, please, if you're still on and you wouldn't mind? I'd be grateful. Thank you.
Okay. So this is going to be,
Slightly difficult.
well, soft and bite-sized. So the filling actually has chunks.
So I'll
in
hold
it.
it.
Okay, I was deconstructing the pie itself.
So the filling has pieces in it, right? And it's a little bit watery, but in there the crust soaked up some of that extra liquid. So
soft and bite-sized.
I want everyone else to have access to it, Susie. That's why I need. Thank you. Oh, the video for the soup recipe, please, that you sent me that we made today. If you would post it, I would be very appreciative.
Right here, if you can. Okay, so
this meal would be good for our Canadian Thanksgiving this weekend.
Yes, exactly. So, okay, soft and bite-sized. I know we're running long today. Soft and bite-sized, you just cut it into bite-sized pieces. Now, if you had a little bit of whipped cream, that would give you a little more moisture to particularly the crust. But you should be able to manage this crust if you mix in some of
the fruit.
The fruit pieces. So soft and bite-sized, cut into with the side of your fork is fine.
Okay.
Now, if you want minced and moist, you would take it and you would mash it with the fork.
Yes.
Mash it this way. And you see if it comes through the tines of a fork, it is small enough. Now again, the fruit will absorb, make the crust not quite so dry. Again, if you add a little whipped cream, that's going to add even more moisture that will make it, this is perfectly. It actually goes to pureed.
Theoretically, you could do this with just about any pie. Thank you, Susie. I appreciate it. You can theoretically do this with any pie that doesn't have hard pieces in it. Now, of course, pecan would not necessarily work for this.
No, probably not.
Because it's a little too hard. Still requires some chewing. So there are things you can do to make your food more accessible. And that's what we want to show you. Whether it's the soup itself, mixing in some potato flakes to get your thickened soup here. I mean, yes, perfect for a Canadian Thanksgiving.
Yes, I'm going to taste it.
Highly recommend. It's really good.
Ooh, that's really good.
It's really good.
Yes.
And we didn't add the tofu because I forgot. But that's okay.
So just add tofu and it would increase the protein.
The other thought I was having was you could also add unflavored collagen protein to this when it's blending, and it would mix in smooth, and that would also increase the amount of protein.
Nice.
Yes. So here you are, everybody. Treatment. We haven't talked about treatment yet. Changing the food texture. This is one option. Okay?
And again, we would change it so that you could get more in, not necessarily to prevent you from aspirating. Unless your aspiration were severe.
Compensatory strategies. I said that word weird.
Compensatory.
Thank you. Exercises from your speech therapist. Very important, from your speech therapist. Specific maneuvers. This is different than compensatory strategies.
Yes, so there's special maneuvers that are exercise related.
Okay. So I have...
And there are other maneuvers that are intended to help food get to where they need it needs
for
to go.
example, and you can tell me where this fits. I have a patient right now, just had a feeding tube placed. She wants to eat. We had her sent for a swallow study. They said in the swallow study that if she turns her head to the right, she is safer to eat based on what they saw from the picture that they took.
That's a strategy.
That's a strategy. Okay, perfect. Thank you for clarifying for me. Okay.
Yep.
Cool. So your speech therapist gives these recommendations to improve your ability to swallow, your safety, your muscle strength, your coordination, etc. And then working hand in hand with a dietitian, because sometimes the exercises can interfere with adequate nutrition, is one thing that you wrote on this. So I love that and appreciate it, because we know that getting appropriate nutrition into your body makes your muscles stronger. If you're working the muscles and you're malnourished, those muscles are not going to do what you want them to do. They're not going to get stronger. They're not going to get more coordinated. You have to get the nutrition in too.
Right. Well, and you'll reach this plateau and not be able to get beyond it. And maybe some of you are there, and that's why you're watching us, because you're at this plateau. And maybe it's you're at the space where your nutrition manages, and you can't get beyond that. So also very important that if you get enough nutrition, like your muscles need to be fed. Your mucous membranes need hydration. There are so many things that can affect your swallow that are more nutrition related than they are related to strength or coordination.
Right. So we had a lady ask a question about hydration in foods too, and I said fruits and vegetables. Both of these, great sources of hydration because they've got all the veggies and the fruit.
That's the kind of hydration I like.
I know. It's great. So eat your fruits and veggies, whether they're in the form of soup or, yeah. Okay. I think we've touched on everything today. We went longer than I expected. I'm sorry. I didn't expect the butternut squash to take quite so long. I was hoping it would be done right about the time we started, and it wasn't. It was thicker than I expected. So thank you all for joining us. We really appreciate you watching in, asking questions, giving us suggestions. I really appreciate you.
Yes, and this was our first night in
the group. Yeah.
And it worked. We figured it out.
And you guys figured it out, because sometimes there's a lag between when you go live and when you find it. So, hey, Mary, we are so happy you're here. We are here to support you, whatever you need.
We are here for you.
Whether it's easing your mind and your fears, we can do that. If you learn a technique or a trick to make your food more beautiful, maybe ideas, because if you are like me, even though I have all this culinary knowledge in my head, I get stuck in a rut with cooking the same things over and over again. So luckily I have a friend like Suzanne who's like, here, make this.
Yeah.
Here, make this.
Yeah.
Here, make this.
So if there's anything you want, please let us know. Send us a link or just tell us. We'll find a link.
Yep.
And we'll try it.
Yeah. All right, everybody. Have a great week. Next week, we're going to talk to you about oral dysphagia.
Oral phase dysphagia.
Oral phase dysphagia, yes. Do we have any updates? We're live in the group. We will continue to be live in the group from now on. If you know of someone that would benefit from this free information, tell them to join the group.
Yeah.
If you want to get notifications about us going live, they're at the top of the group and the top of our page. There's a link you can click on to submit a form. You'll need your cell phone number. And if you live in another country, because I had this happen this week, I added an email address. So you'll get an email link with the link to the group that we're going live. So if you're in the US, you can use your cell number. If you're in another country, put in your email address and you'll get notified half an hour before we go live.
We'll see you guys next week.
We love you. We appreciate you. We are here for you. I hope you enjoy the rest of your week.
Have a good one, guys. Bye.